All right. Hey there. My name is Dr. Andrew Gorecki. For those that don't know me, my job is to help people that are struggling with back pain find a natural solution so they don't have to take medications, injections, or get surgery. And if you like what I'm talking about today, you're serious about finding a solution for your back pain, I'd encourage you to visit back-class.com. That's where I'm going to teach you even more great stuff on ways to heal naturally from back pain. So today, I want to help the people that are out there that their back went out or started hurting, let's say a month ago. Now they've gone in and seen their doctor. They've gone to their doctor like most of us would do after our back is hurting for a period of time. It seems like it's not going away when it's on its own. And so you went into the doctor, and what did you get? Well, and I know this personally because I went through this myself. Back in 2004, I had over 18 months of back pain and sciatica. I was completely disabled, couldn't do anything, couldn't put my shoes on, couldn't do any exercise, hardly could walk or stand for long periods of time, couldn't even sit in a chair. So you go to the doctor, and the first thing that you get is typically going to be an anti-inflammatory medication or a pain medication, sometimes even both if it's bad enough. And so you go and you get this prescription and these and then there's this kind of response of, well, let's take these and see how things go, and I'll see you in 2 or 3 weeks. Very typical as the first kind of response. And so what happens there? What is that? Well, we know that most back pain has, well, first of all, the goal is to make you feel comfortable, right? Your doctor cares about you. They want you to be comfortable. They want that pain level to go down so you can get sleep and enjoy your life. But most of the time with back pain, that doesn't fix anything, right? So it's not uncommon. So if you're out there and you've done this and you're kind of in that waiting period and you've taken these anti-inflammatory medications and the pain medicine, and it's not really doing anything for you, it hasn't changed your back pain. Maybe it lowers the level of back pain, but it hasn't made it go away. That's not uncommon. Most back pain is a movement problem, meaning something in your body's not moving properly and it's causing stress or more motion into your lower back. And so the anti-inflammatory medication and the pain medication really just inhibit the body's ability to respond to that stress. So it makes your brain feel less pain. It makes the body's inflammation response less, which, by the way, inflammation is actually the body's natural way to initiate the healing process. So there's 4 phases to the healing process. Inflammation is phase 2. So by taking anti-inflammatories, you're actually stopping the healing process. What we should be doing is we should be thinking, all right, what's actually causing inflammation to happen in the first place? And that's going to be tissue damage from too much motion. What a beautiful day. Hope you don't mind me being in my backyard. Just taking a quick break to take this video. I can see my kids' messy toys in the background. So anyways, if you're out there and you're kind of frustrated, you've gone to your doctor, you've gotten these medications, and now you're not better. That's not uncommon, so don't get too worked up. Don't get too bummed out. What's the next step, right? What is the next step? Well, here's what's going to happen. You're going to go, if you go back and see your doctor, which is not saying don't, what would be expected in the next round is probably an x-ray or an MRI. And that's an image. Like, they want to see what's going on inside your body. And as I've talked about this in many other videos, the problem with that is that if you're over the age of 20 years old, they're going to find something on those images. It's natural for our body to change, to age inside, just like it does on the outside. So you're going to find things like arthritis and disc bulges and degenerative disc disease. Those are normal and natural. And the problem with getting the image is that doesn't fix your problem. It just gives you more information about how your body's changing. And what you see on the image may or may not be the cause of your pain. So what I would recommend is seeing a physical therapist. A physical therapist is going to be able to look at how your body moves, be able to assess how the back itself moves, where you're limited. But most importantly, you want to look at the areas above and below the lower back. So the hips are a really, really important place to start. Most back pain, regardless of the diagnosis on an image, is actually a result of bad hip motion or bad upper spine motion that's causing too much motion to go through your lower back, and therefore you're getting damage and pain. So hopefully that helps. If you've gone in that first step and you've gone to the doctor, you've gotten your pain medication or your anti-inflammatories and it hasn't made it go away, don't be bummed out. That's pretty common. The next step would be either to go back to the doctor to get imaging or to go to a physical therapist. If you want it to be faster, I would go see that physical therapist as soon as you can. But if you're serious about finding a natural solution, you like what I'm talking about today, I would encourage you to visit back-class.com. That's where you can join me on a workshop where I talk more about these concepts and give you all kinds of useful tips on how to relieve your back pain and find a solution that's not requiring medications, injections, or surgeries. Hope you enjoy, and I hope you get out there and you find a solution.